What if I told you that the brown spots you've been ignoring for years could be the earliest warning signs of diseases that don't show symptoms until it's almost too late? Most people over 60 have been told the same thing. Those are just age spots, harmless, cosmetic, nothing to worry about. And so you stop paying attention. You live your life assuming your body will let you know when something is wrong. But after years of clinical observation, I can tell you this with certainty. Your body rarely starts with pain. It starts with subtle changes, small visual signals, quiet shifts that most people overlook because they don't seem urgent. I've seen patients miss early signs of skin cancer, liver dysfunction, and blood sugar imbalance, not because the signs weren't there, but because they didn't know what they were looking at. Your skin is not just aging, it's reporting. And once you understand what those changes actually mean, you may never look at your own hands or your reflection the same way again. Before we dive in, if you haven't subscribed yet, I recommend you hit that button and turn on the bell so you never miss another health tip made just for you. If you enjoy this video, type 1 in the comments. If not, type 0 to let me know how I can make better content for you. 1. When an age spot starts rising or thickening, a silent shift you should never ignore. Have you ever run your fingers across a spot on your skin and thought, that didn't feel like this before, and then brushed it off as just another part of getting older? That quiet moment right there is where many people miss the earliest warning sign their body is trying to give them. A typical age spot, what doctors call a solar lentigo, is flat. It sits on the surface of your skin, usually smooth, with a consistent texture. It may darken slightly over time, but it doesn't suddenly change how it feels under your fingertips. So when a spot begins to thicken, rise, or develop a rough, almost waxy or crusted surface, that is not a normal part of aging anymore. That is a change in behavior, and in medicine, behavior matters more than appearance. In older adults, especially those over 60 who have had decades of sun exposure, the skin has accumulated layers of damage that don't always show up all at once. Instead, they evolve slowly. What used to be a harmless pigment spot can, over time, begin transforming at the cellular level. One condition this may point to is melanoma, a serious and potentially life-threatening skin cancer that often starts subtly. It doesn't always appear as a dramatic black lesion. In fact, many early melanomas begin as something that looks very close to a typical age spot until texture changes give it away. Here's what makes this especially dangerous for seniors. Your skin becomes thinner. Your immune system becomes less efficient at catching abnormal cells, and healing slows down. That means harmful changes can progress quietly without causing pain or discomfort. You won't feel it coming. You'll only see it if you're paying attention. There are specific details I want you to check right now, not later. Run your finger gently over the spot. Does it feel thicker than the surrounding skin? Does it have a slightly raised edge? Has it developed a dry, scaly, or crusted surface that wasn't there a few months ago? Even a subtle elevation can be meaningful, especially if that spot used to be flat for years. Now, let's talk about consequences, because this is where hesitation becomes risky. If a melanoma is caught early, it can often be removed with a simple outpatient procedure. But if it is ignored and allowed to grow deeper into the skin, it can spread to lymph nodes and other organs. At that stage, treatment becomes more aggressive, more invasive, and outcomes become far less predictable. This is not about causing fear. It's about giving you clarity. Your body rarely sends dramatic warnings first. It sends small, physical changes, like a spot that no longer feels the same. If you notice this kind of change, the next step is not to guess or wait. Take a clear photo today. Compare it in a few weeks, and if there is any doubt, schedule a skin check. That single decision could change the course of your health. Because what matters even more than how a spot feels is what happens when its edges start to lose their shape. And that's where the next warning sign becomes even more serious. If you're still watching and finding these insights helpful, please comment number 1 below to let me know you're with me. Now let's move on to point number 2. 2. When the edges become irregular or blurred. Have you ever looked at a spot on your skin and thought, I swear that used to be more defined, but then shrugged it off because it didn't hurt? That quiet moment of doubt is exactly where many serious conditions begin to go unnoticed. A typical age spot has a clear, well-defined border. You can trace its outline with your eyes almost like it was drawn on your skin. It stays contained, predictable, and stable for years. But when the edges start to lose that clarity, when they become uneven, jagged, or appear to bleed into the surrounding skin, that's no longer a cosmetic detail. That's a biological signal. What's happening underneath is a change in how skin cells are growing and spreading. Instead of staying organized, they begin to expand in an irregular pattern. This is one of the early visual signs doctors are trained to recognize when evaluating potential skin cancer, including melanoma. Now, here's where it becomes especially important for older adults in the United States. Many people over 60 have a long history of sun exposure, gardening, driving, walking outdoors, or simply living in sunnier states like Florida, Arizona, or California. Over decades, ultraviolet radiation damages the DNA inside skin cells. Most of the time, your body repairs that damage, but not always. When repair mechanisms slow down with age, those damaged cells can begin to grow in ways that are no longer controlled. The first visible clue is often not size or pain, it's the border. An irregular edge might look like one side of the spot is smooth, while the other is uneven. The outline appears scalloped or jagged instead of round. The pigment fades gradually into the surrounding skin instead of stopping cleanly. What makes this dangerous is how easy it is to dismiss. There's no discomfort, no urgency. Just a subtle visual change that most people assume isn't worth a doctor's visit. But here's the reality. Early stage skin cancer is highly treatable, often with a simple outpatient procedure. Once it spreads deeper into the skin or beyond, treatment becomes far more complex and outcomes less predictable. There's also a psychological barrier many seniors face, not wanting to overreact or waste the doctor's time. In truth, dermatologists would much rather evaluate something early and find nothing serious than see it months later when options are limited. A practical step you can take today is this. Look at your spots under good lighting and compare them side by side. If one looks noticeably different from the others, especially in its border, that alone is worth attention. Take a clear photo and store it on your phone. In a month, look again. Change over time is one of the most important diagnostic clues. Because sometimes it's not the shape alone that tells the story, it's the color inside that shape that reveals something far more concerning. 3. When one spot has multiple colors. It's easy to ignore a spot when it still looks brown enough, but But let me ask you something. What if that one spot on your skin quietly started carrying two, three, even four different shades, and you never realized that alone could be a warning sign? Most age spots in older adults are uniform. One consistent tone, usually light to medium brown, stable over time. That's what normal looks like. But when you begin to see variation within a single spot, darker areas, lighter patches, maybe even hints of red, gray, or black, that is not just a cosmetic change. That's your body showing inconsistency at the cellular level. Here's what's happening beneath the surface. Skin pigment is produced by specialized cells called melanocytes. In a healthy system, these cells distribute pigment evenly. But when something disrupts their function, whether it's DNA damage from years of sun exposure, declining immune surveillance, or abnormal cell signaling, they begin to behave unpredictably. Some areas produce more pigment, others less. The result is a patch of skin that no longer has a single, stable color. One condition associated with this pattern is acrolentigenous melanoma, a form of melanoma that can appear subtle at first glance, but becomes dangerous when overlooked. What makes it particularly concerning is that it doesn't always follow the dramatic patterns people expect from skin cancer. It can sit quietly, looking like a slightly unusual age spot while gradually evolving underneath. For seniors, this risk is amplified. After 60, the body's ability to detect and eliminate abnormal cells declines. That means irregular cells have more opportunity to grow unchecked. Combine that with decades of accumulated sun exposure, and the skin becomes a record of both past damage and present vulnerability. Now, here's the part that often gets missed in real life. People don't usually examine their skin under good lighting. They glance in the mirror, maybe in a dim bathroom, and everything looks about the same. But subtle color variations are exactly what you need to catch early. What should you actually look for? A spot where the center is darker than the edges, or where one side appears almost black while another looks tan or reddish. Any uneven distribution of color within a single lesion should raise your attention, not panic, but awareness. And here's a practical step you can take today that most people never do. Use your phone camera in natural daylight and zoom in on one or two spots that seem different. When you enlarge the image, color variation becomes much more obvious. What looks uniform to the naked eye often reveals multiple tones when examined closely. Ignoring these changes is what allows small abnormalities to evolve into serious conditions. Catching them early often means simple treatment and peace of mind. Because sometimes the real danger isn't just in how many colors a spot has. It's in what your entire skin tone is starting to reveal about what's happening deeper inside your body. If you're still watching and finding these insights valuable, please comment number 1 below to let me know you're here. Now, let's keep going with point number 4. 4. When age spots appear alongside yellowing skin or eyes. You might not notice it at first. It's not dramatic, not something that stops you in your tracks. But one day the mirror feels slightly different. Your skin looks a bit more yellow than usual. Your eyes don't seem as bright. And those age spots on your hands or face suddenly appear darker or more pronounced. Most people blame lighting, dehydration, or just getting older. That quiet dismissal is where a deeper issue can remain hidden. When your skin tone begins to shift toward yellow, especially in combination with more noticeable pigmentation, Your body may be signaling a problem that has nothing to do with the surface at all. This pattern is often associated with liver disease, and more specifically with the buildup of a substance called bilirubin. Bilirubin is a natural byproduct of red blood cell breakdown, and under normal conditions, your liver processes and clears it efficiently. But when the liver becomes overwhelmed or begins to decline, bilirubin accumulates in the bloodstream and starts to deposit in tissues, including your skin and the whites of your eyes. For adults over 60, this becomes particularly important. The liver, like every organ, changes with age. Blood flow through the liver can decrease, metabolic processes slow down, and the cumulative effects of medications, alcohol, diet, and chronic conditions begin to add up. The challenge is that early liver dysfunction rarely causes pain. There is no sharp warning, no immediate discomfort. Instead, the body communicates in subtle visual ways: slight yellowing, changes in skin tone, and shifts in how pigmentation appears. What many people don't realize is that the skin acts as a secondary pathway when the liver is under stress. When detoxification processes are impaired, certain compounds that should be cleared internally can influence skin cells, including those responsible for pigment. That's why age spots may appear darker or more widespread, not because the spots themselves are changing independently, but because the internal environment is shifting. In real life, this is often overlooked because the changes happen gradually. You see yourself every day, so small differences don't stand out. Friends or family might notice before you do, but they may hesitate to say anything. Meanwhile, the underlying issue continues to develop quietly. So, what should you do if you notice this combination? Start by paying attention to patterns. Is the yellow tone consistent even in natural daylight? Do your eyes appear slightly tinted? Are you feeling more fatigued than usual without a clear reason? These are not signs to ignore or wait and see. A simple set of liver function tests, readily available through your primary care provider in the US, can give you clear answers quickly. These are routine, affordable, and often covered by insurance. Early detection can prevent progression into more serious conditions like cirrhosis, where damage becomes far harder to reverse. Because sometimes the most important signal isn't just what you see on your skin, it's how your entire body is starting to handle something as fundamental as blood sugar. And that's where the next warning sign becomes impossible to ignore. 5. When age spots appear alongside darkened skin around the neck or hands. It usually doesn't start with concern, it starts with familiarity. You notice the skin around your neck looks a little darker than it used to, maybe slightly thicker, almost like a shadow that doesn't wash off. At the same time, age spots on your hands seem to be multiplying or becoming more pronounced. Most people assume it's just another sign of aging, something cosmetic, something harmless. But in many cases, this pattern is your body pointing to a deeper metabolic issue that deserves attention. When darkened, thickened skin appears in areas like the neck, underarms, or even across the knuckles, especially alongside increasing pigmentation. It can be associated with type 2 diabetes or a condition known as insulin resistance. This is not just about sugar levels being a little high, it's about how your body is struggling to use insulin effectively, which affects multiple systems over time. Here's what's happening beneath the surface. Insulin is a hormone that helps move glucose from your bloodstream into your cells, where it's used for energy. But when your body becomes resistant to insulin, a process that becomes more common with age, your pancreas compensates by producing more of it. Elevated insulin levels don't just affect blood sugar, they also stimulate skin cells to grow and thicken abnormally, leading to those darker, velvety patches. For older adults in the US, this is particularly important because type 2 diabetes often develops gradually. It doesn't usually begin with dramatic symptoms. Instead, it builds quietly over years. Many people feel mostly fine, while underlying changes are already affecting blood vessels, nerves, and organs. What makes this dangerous is not just the condition itself, but how easily it's dismissed. There's no pain in darkened skin, no urgency, just a visual change that blends into the natural aging process. Meanwhile, blood sugar levels may be rising, circulation may be slowly declining, and the risk for complications, heart disease, kidney issues, nerve damage, continues to increase. In real everyday terms, this might show up as feeling more tired than usual, needing to urinate more frequently, or noticing that small cuts take longer to heal. But even without those signs, the skin can be one of the earliest indicators. So, what can you do right now? First, don't ignore patterns. If you see darkening in typical areas like the neck or hands combined with changing age spots, take it seriously. Second, request simple lab tests, fasting glucose and HbA1c. These are standard, widely available, and often part of routine care for seniors in the United States. Catching insulin resistance early gives you the opportunity to make manageable changes, adjusting diet, increasing daily movement, and working with your healthcare provider before complications develop. Because at this stage, your body is still giving you a chance to respond. And when you step back and look at all five signs together, a much bigger picture begins to form, one that most people never see until it's far too late. The truth your skin has been trying to tell you all along. There's something most people don't fully realize until much later in life. Your body rarely fails suddenly. It whispers first, it signals, it leaves small, quiet clues long before anything becomes urgent or irreversible. And as we age, those signals become even more subtle, easier to overlook, and far more important to understand. What you've seen throughout this video is not just information about age spots. It's a shift in how you look at your own body. Those marks on your skin are not random. They are reflections of processes happening beneath the surface, cellular changes, metabolic shifts, organ function, and long-term exposure to the environment you've lived in for decades. After the age of 60, the body becomes more vulnerable in ways that are not always visible day to day. Repair slows down, inflammation lingers longer. Systems that once corrected themselves automatically now require support and attention. And here's the part many people don't talk about. Some of the most important changes happen quietly, even while you sleep. At night, your body is supposed to repair, regulate, and reset. But if underlying issues like unstable blood sugar, reduced oxygen levels, or organ stress are present, that recovery process becomes less effective. Over time, that affects everything: your energy, your immune system, your skin, and your overall resilience. What looks like a simple external change can actually be part of a much larger internal story. Now, think about the next 1 to 5 years of your life, not in a fearful way, but in a realistic, informed way. The choices you make today, whether you pay attention to these early signs or ignore them, will directly shape how your body functions in the near future. Conditions like skin cancer, liver dysfunction, and type 2 diabetes do not appear overnight. They develop gradually, often silently, and by the time they demand attention, they are much harder to manage. But here's the empowering part: you are not without control. Understanding these signals gives you a window of opportunity. Acting early often means simpler solutions, less invasive treatments, and a significantly better quality of life. This is not about becoming anxious or checking your skin obsessively. It's about awareness. It's about noticing change, respecting it, and responding appropriately. A simple decision to take a closer look, to ask a question, or to schedule a routine check can prevent years of complications. Your body is not working against you. It is communicating with you the only way it knows how. The real difference moving forward is whether you choose to listen or continue overlooking the very signals that could protect your health for years to come. These lessons are meant to inspire you to live fully and authentically. Now, I'd love to hear from you. Take a moment to reflect and share one thing you've learned and plan to apply in your own life. Let's support each other on this journey toward embracing these truths. If you enjoyed this video, please leave a comment with 1. If not, feel free to comment with 0. Your feedback means a lot to us. Don't forget to like, share, and subscribe to our YouTube channel for more content like this. Thank you for watching, and here's to living life on your own terms.